This addresses the presentation made by Mountain Lifelight at the December 16 meeting, and I'd simply ask Mr. Chittick if he would concur with that or not.
Well, first and foremost, I want to thank the board for giving staff direction to address this because, I'm sorry, Eugene Chittick, because it was a very specific issue to patient care. We saw it as that, and staff gave me a lot of time to present those facts, and it took a little bit of massaging to get there. But I think staff should be commended for their efforts because this was no easy task, and thank you, Mr. Pyle, for weighing in on it and giving staff your direction because that was helpful in coming to a resolution. So I think this addresses our initial issues, and I don't think there's any need for further presentation outlining those issues as long as it's approved by the board.
Thank you. And what I might also say is that we've, and Mr. Narrat has just come in, we undertook this issue a bit early, and my days of predicting are gone. Sorry. And so, having had some conversation with Mr. Narrat, but I also think Mr. Spees, is he here? Yeah, he's here, from NorCal EMS. Maybe since he's here, he can, thank you. Well, we've had long, just like Mr. Egan, the CAO, said, we've had long discussions about this over the past week, even more. And I believe that NorCal EMS concurs with the proposed amended EMS transportation plan.
Okay, I think that's all I take for public comment. Joe, good?
To be honest, sir, it's been, you've discussed it, and
Good?
everything I want to bring up. Thank you.
Okay, thank you. Mr. Ryan?
Good morning, Mike Williams. I'm the Vice President and Chief Operating Officer of SEMSA, and I appreciate the opportunity to speak. We have been very silent throughout this process, as we have been in our relationship with the county since we came here over 10 years ago. I don't have to remind some of you, we were requested to come in here when your ambulance service departed. We bid on a contract and were awarded it, and I believe we have been a good partner to this community and the county. We've requested no subsidy. We have not asked for anything from the community. And the fire chiefs are here should you have any questions about our character and what we've tried to do in the time that we've been here. Mountain Lifelight, at the last county commission meeting, did a presentation, and I'm not quite certain they really did you justice in providing you all the information that you need. This organization was started by the same people that required us to come in here in the past. They have been working the system to their advantage, and they have been operating outside what has been designated an exclusive operating area. They will tell you that this is in the best interest of the patient. Gentlemen, I have been doing this for 43 years. I have been a state regulator. I was the EMS director for the state of Florida. I was the CEO of the nation's largest ambulance service. I have run a trauma center in the city of Atlanta and the EMS system there. Some people would say that I kind of know what I'm talking about. And the one thing that you will hear in any argument about an EMS system is patient care. And it's very easy to stand up and say, I'm doing what's in the best interest of the patient. And when you have the general public, their understanding of that is, I have to take your word for it. This organization, Mountain Lifelight, has never once asked or tried to act collaboratively with SEMSA. They've never asked if they could put their nurse on our ambulance. And you got to ask yourself why. So let me give you a little short EMS economics lesson. Follow the money. The fact of the matter is, in every county in the state of California and in most areas of the United States, transport to an airport for a fixed-wing transport is provided by the provider that has an exclusive operating area. EOAs were authorized by the California legislature because the cost of doing business as an ambulance service runs a very fine margin. We are a not-for-profit organization, and it's still tight in Lassen County. Every transport counts economically. In the case of the transports to the airport, do you realize what that allows Mountain Life Flight to do is bill Medicare or an insurer for a ground ambulance transport, then turn around and bill them again for an air ambulance transport. When Mountain Life Flight can't fly, they have a horrible economic situation that they have a pilot, they have a nurse, and they have a paramedic sitting on the ground, not generating any revenue, not doing anything to help the community. I appreciate how they would like to have them engaged so that they can generate revenue. I certainly would try to do that also. The other thing is, by carving out this one section, you are leaving them unregulated. And I'd like to point out, as of today, they are not a licensed, permitted, regulated ambulance service except to do basic life support transport with an EMT. They are not qualified to do ground ambulance transports for critical care patients. They would like you to believe the inside of an ambulance looks just like the inside of a helicopter, that looks just like the inside of an emergency department. They are three different environments, gentlemen. On the list of the papers that were provided to you was a list of why Mountain Life Flight deserves this consideration. It kind of insinuated that SEMSA is not doing the same things that they are. I very quickly want to point out, we are a not-for-profit company, but we still pay taxes to the state of California and in Lassen County. Our payroll far exceeds that of Mountain Life Flight. We make thousands of dollars in purchases every year from the local businesses. We support Lassen County events with free standbys. All the leases on our facilities, and there are 3 of them, are by Lassen County landlords. And most of our employees who also live here also pay taxes. Another comment that they make is the big profits that are leaving. I will remind you, we are a not-for-profit corporation. I am on a fixed salary, and if we make $1 million or we lose $1 million, I still get paid the same, except if we lose $1 million, I probably lose my job. Now, are interfacility transports part of your EOA today? Yes. Should they be? Yes. My curiosity is in a couple of areas. Number one, the RFP that Dr. Mayrad is drafting for you hasn't been seen by anybody. I'm sure we can count on county staff to be doing the right thing. What is the real motive here? It's the lucrative double billing of payers. And by the way, the payers, meaning Medicare, Medi-Cal, private insurance, reimburse at a higher rate for a critical care transport. And they almost always reimburse without question because it was a critical care patient. So these are the transports that have guaranteed pay as opposed to 75 to 85% of the transports that we do that we do not get reimbursed for. If you honor Mountain Life Flight's demands here today, it could tip the balance of ambulance service being able to financially survive in the environment that Lassen County has. Our request is not to make these changes, not to listen to stuff about how it's better patient care, and start asking the questions, why can't this upstanding corporate citizen in this community work as a partner with your ambulance provider instead of working behind the scenes to try to get what they want? Thank you for your time. I'll be here if you have any questions. I'd be glad to answer them.
Any questions for the board?
Thank you.
Okay, who else would wish to speak? Somebody, Rick, Nurse Nera, and you guys, Dan, Steve, you guys all happy?
Would the board allow response to that last statement?
Well, since you haven't spoken yet, I'll let you speak.
I'm only as a rebuttal to.
Well, come to the podium and state your name.
My name is Brian Graham, Program Director now with Lifeline. Really just more on a rebuttal to some of the things that were just brought up. Mr. Nairn himself stood up at the meeting and said, currently there is no exclusive operating for interfacility transfers. That was his words. I didn't really want to argue it one way or another. If our current EMS system is so on the edge, we were, again, talking about these critical care transfers, about 25 a year. And and this was for patient care and delay. This is not a financial question. And if we're on so thin ice that 25 out of almost 700 a year are going to be the make or break. My only opinion is it's not the number, it's the exclusivity. Also, we have worked with SEMSA before. We have put our nurses on SEMSA ambulances before. This isn't something that we have never done before. But in the interest of time and patient care, and I don't mind saying patient care, because it is the truth, it is patient care. And having an air crew, having a delay to get to that is a patient care issue. It is not a financial situation. That's all I really wish to say.
Well, Vern, I got one question.
Sure.
When the fixed wing aircraft gets to Reno, I guess it lands to Reno Airport, and then from there to the hospital, they must have to get, I'm going to guess, Remington?
Yeah.
To pick them up in the flight crew and move them. So does the patient get billed again for that?
Yes. You know, the other thing,
So,
when we,
I'm sorry. If a patient is picked up at Data Lassen, flown fixed wing by Mountain Lifeline to Reno, they get billed 3 times?
yes, just like they get billed 3 times as SEMSA took them. Once by SEMSA, once by us, and once by REMSA. That's why, fixed wing is not your, fixed wing is usually, it's a weather issue. That's why the majority of things are portal to portal.
Helicopter goes to hospital to hospital. So that's going to be cheaper than a fixed wing. Is that correct?
Fixed wing has a lower reimbursement, it's a lower charge. It's a lower charge. But also, just to also answer, he kind of made a thing about sort of double dipping. It's the same exact situation they have in Reno. If CareFlight has to transfer to anything, REMSA, CareFlight, SEMSA, it's all the same umbrella.
Anybody got
I have a question, and maybe, I'm not sure who can answer it, maybe Bob or Richard could, or maybe Brian or Mr. Williams could. I thought I saw in here that we have, here it is on page 6, above the amendment that was being proposed here, it says an estimated 368 patients per year are transported by air ambulance in Lassen County. And obviously, the fixed wing only happens when weather requires it. For the most part, it's by helicopter. So, out of 368 transports, how many transports are we actually talking about that's affected by this provision?
We think 24, 25. Yes. That's the number that was provided to us. We're relying on those involved. 24 to 25.
Which is
approximate number. We're talking about 24 to 25 transports from Banner Lassen Hospital down to Susanville Municipal Airport for subsequent loading onto a fixed-wing aircraft.
So those 24 or 25 transports is a make or break thing for either of the two providers that we have involved in the system? Is that what I'm hearing?
On my end, it's not a make or break thing, it's a patient care and lack of delay. We can actually go up at a moment's notice without putting any stress on the 911 system, without pulling 30, I mean, currently there's only 3 ambulances. They run us up there, they're tied to us. We've basically just eliminated 33% of our capacity for 911 calls to tie up an ambulance to go do that. If they're on calls, we might have to wait. If they have to take a call once we're up there, again, patient delay. We're not doing this to try to elbow into their exclusive operating, which currently right now, as stated, there isn't one on interfacility transfers. It's basically just to maintain our level of patient care where we can, at a moment's notice, excuse me, go grab a patient and get them in the most fast, expedient way to our aircraft and get them moving down the road.
Thank you, Brian. Any other questions? Lady in the back, you want to
Yeah,
come up to the podium and give your
I'm
name?
Kimberly Brady, and I'm wondering, and then what, the patients are flown by an unlicensed pilot? Are you the one who hires?
Please address your
Does all the hiring?
Kimberly, good question to us.
Well, he seems like the director and in charge. I mean, they're gonna have anybody fly the helicopter, and that's the best for the patients?
I don't think so.
It seems, I think Sense is right about they will do anything, and it's all about money.
Brian, if you want a chance to answer that question.
I'd like to answer that. Keith Crosby, General Manager. No, the statement Mr. Williams made is absolutely 100% incorrect. We are licensed. We have an agreement with NorCal to do the ground ambulance that we're doing right now. We have an agreement to operate the fixed wing and the helicopter with licensed pilots, licensed paramedics, licensed nurses. All of them are licensed. They're all going to run through the same agencies that SIMSA operates under.
Just like the one helicopter pilot was.
Exactly like everybody.
Without you knowing. Unknowing for how many years did you fly?
What you're talking about is something that you don't actually have knowledge of.
Yes, I do.
Okay. Anybody else in the public wish to speak on this issue? Seeing none, I'll bring it back to the board. Which the guy is like, do you have any more questions to ask? Mr. Narad, you want to speak?
Yeah, I just want to clarify one thing. In terms of the Rick Narad, thank you. In terms of the interfacility transfer not being part of the current plan, the state law that authorizes granting of exclusive operating areas lists out 3 areas: emergency ambulance service, advanced life support, limited advanced life support. It doesn't have a specific category for IFT. The state's interpretation of emergency ambulance has been that it includes all calls, so that by putting an emergency ambulance in the 2004 plan, it covered the entire range of calls. In the revision this year, because of the confusion issues that have gone on, a decision was made to try to make that section more explicit as far as what was in and what was not in. But
Who made that decision?
that was in discussion with county staff and with NorCal staff, and to try to make it clear to avoid some of the problems.
And when was that done?
I cannot tell you specifically. The discussions have been going on for 6-9 months now. I just don't remember exactly when.
Richard, do you have anything?
Yeah, I think for clarification, Mr. Mayor, could you explain exactly what the existing contract contains in terms of the IFTs and if it was enforced according to those terms or not, or what the current status was in terms of these transfers from hospital to
The current contract that's between Lassen County and SEMSA lists out the exclusivity by referring to the plan. The 2004 plan is approved. And in that plan, the phrase of emergency ambulance service was used to define the exclusivity. So there wasn't a specific section put in there. In terms of enforcement, I can't really say because the county's been doing the enforcement for 10 years. I didn't know the monitoring it.
Well, in practice, how is it occurring over the last 10 years?
I'm sorry,
How are these transfers occurring over the last 10 years in terms of practicality?
I cannot tell you. Allegedly, and I have no data to show it, but allegedly there were calls done by someone other than Samson. Okay, there have been complaints about it, but I haven't seen specifics to say to what degree it's been done, what hasn't been done. I haven't been involved with the regulatory process, so I can't really say the specifics of it.
Any other questions?
So as you're going through this process, knowing that this is going to be coming up, the new RFP, I mean, why wouldn't you guys talk to the ambulance providers that are here and say, hey, this is coming up, what are some things that we could change or need to change? I mean, why weren't they involved in the loop, or were they?
Well, I thought they were. We had a public meeting with the MCC that gave everyone an opportunity to have input. That was part of the process of developing the plan. Very often, you don't want to aim your request for changes to your existing providers because you don't want to give them the benefit of having shaped the plan. Instead, you want to say, okay, from the viewpoint of the public, county staff, other people, what's needed, but not necessarily from the viewpoint of the provider who may have a different interest.
Right.
So it wasn't addressed to them specifically in that sense.
And how would those be notified?
You're going to have to ask county staff that.
Okay.
It was the meeting of the Emergency Medical Services Committee, but I don't know how they noticed it.
How would they?
Of course, the board meetings were noticed as all of our board meetings were transportation. The EMCC meetings, I know they were notified all the members of the EMCC, whether or not that was published. I could check it to see if it was published as a public meeting or not.
I only have a question.
Yes, could I ask a question?
I am Kane speaking here. I was an emergency patient back in December 10th, and had to go to the emergency here in Lassen County, and I'm still suffering the consequences of that accident, but I was knocked unconscious and hurt the back of my neck, and it has to do with my equilibrium and my synovium up there. So I can remember parts of it. Emergency ever took me. The ambulance picked me up, and it was, whatever the flight did here. I can't remember a lot of it. But anyway, I was taken from ambulance to the airport. I can remember being in a plane and flown into Reno. But I was beginning to get a little better because I wasn't moving. And there was another ambulance at the airport. All right? I don't know who. You know, Tati, my question is, the ambulance at the airport took me to St. Mary's emergency. And they stopped along the way because there was an accident. All right? And I want to know, that ambulance that took me from the airport to St. Mary's, what ambulance was that, or who, or what corporation? Because as I look back at it, I think since I was an emergency and came first from the high flight, type thing, that I should have went directly to the hospital and not sit there and have someone inquire if someone's hurt in that accident. But who was that? And is there another ambulance that takes over in Reno? Is there another ambulance that takes over in Reno?
I would guess, I don't know for a fact, I would guess it's Remza, that is the ground ambulance service in Reno, and we're not part of that.
You're not part of that transfer. Okay, that's what I wanted to know because
That's not part
That's not
of
part
any
of
of the Lassen County Transportation
nothing,
Plan.
even though I went in on,
It is, that's true.
That's not part of the.
But to find out who that is probably going to be the people that send you the bill.
well, I got a big bill of $84,000.
Sorry, I know.
Sure there's a phone number on the bill.
I did.
Thank you, Jim.
Just
Where's the Jim for?
Just as a side, hopefully it's not the North Koreans that were in charge of that ambulance. But I think I want to go back to comments from both the ambulances that are in the room here, and the concern I have, and I've expressed it back in December, and I'll express it again. and it kind of directs back to county staff, and I appreciate the work county staff has done and has brought this forward, I think in cooperation with the discussions with both NorCal EMS and with our consultant and so forth. Because back in December, we were basically told emphatically we can't do anything, and everything's locked in or whatever. The concern I have and what's going to operate, at least from my perspective in terms of how I vote on this particular item, is directly tied to the process and how open the process is and how much transparency there is in terms of the deliberations. And what I've listened to for about the last 30 days has been a lot of consternations about things operating under the radar. And I think the questions that Mr. Alva asked and others in terms of notifications and so forth. What's surprising to me, I just need to get it out there for what it's worth, is 10 years from now, we'll be going through this again as a county. I won't be here to be a part of it, so this will be my last shot at being able to do it. I was here 10 years ago when we went through the last process and remember the trauma that brought to the community as well as I think to the whole operations. And the good news is I think for the last 10 years we've had a very professional and very successful providing the services, and I think that's the goal that we have to have, for the future, how that can be achieved. And I did receive a call from Mr. Smith, Patrick Smith from SIMSA over the weekend, obviously concerned about the discussion, couldn't be here today, he has to be in Texas or something to do with his grandkids, which is fully understandable. But the contract that was brought to the board last fall, and I wasn't here in September, unfortunately, I was absent at the meeting in which that was presented and discussed and the transportation plan was adopted. Not that my presence then would have changed anything, because I think I would have been operating under the same impressions the rest of the board operated at the time, is that we were in essence ratifying, or continuing the contract and the RFP and the manner of conducting business from 10 years before. Obviously, there were some ambiguities that apparently emerged as a result of the original contract, and there was an attempt made by staff, probably by the EMCC, to bring about some clarifications to try to make it a deal, and that's been the genesis of the current fuss that's before us. I think the discussion we're having now is great, but that discussion should have happened like 6 months ago, leading into that process. And this is really directed more towards staff, and I think it's a lesson to be learned that in the future, whether it's on this kind of an option or some other area that comes before the board where we have to deliberate and take an action, that if we have these kind of competing interests and so forth, and I don't think that 24 or 25 transports in a year's time is going to make or break any of the corporations that are involved. At least I would hope that's not the case. But maybe it is. Who knows? Maybe things are paper thin. But I think it's incumbent upon us to make sure that the discussions take place in full. Now, I'm not saying it hasn't. It's happened at different levels. It's happened at the staff level. It's happened at the EMC level. But it hasn't happened at the community level, and it hasn't necessarily happened at the board level. And I think if we're going to have, as I told Mr. Smith, that whoever is the successful bidder from this next RFP process has to be able to operate in the next 10 years with credibility. And what we do when we don't have the kind of discussions we're having today 6 months ago is that we undermine or create the potential for lack of credibility for whoever the successful bidder is. And I think that's where we do a disservice, not only to ourselves, but to the public interest at large. And so I'm glad that we're able to, from what we were told last December, that we absolutely could not consider anything without jeopardizing the future. And then because of this other defect and what staff was able to learn and what EMC, the NorCal EMS and our consultant have been able to determine that we can make the modifications to the transportation plan to bring it into conformity with what the state's requiring, but at the same time also address this other issue of whether or not exclusivity means everything or exclusivity means this, with this not being part of the equation, which apparently has been the case for the last 10 years. And there hasn't been a lot of fuss or muss about it, at least to the board level. Now, I'm not saying that there hasn't been consternation amongst the providers and the individual. But I think that, Mr. Chairman, I think is the fundamental thing. And I'm glad to see that we do have something before us that can hopefully allow us to continue to move on and provide the high quality of care that we've been able to enjoy. And I'm like Iona, having had the opportunity of having one of those helicopter rides here in the last few years. It's an experience of a lifetime, and the bills that you get give you the heart attack they think you're having when you're sitting there. So.
Okay, thank you, Chairman. Supervisor Ron.
Rick, is the system working now? And how well?
And I have not been monitoring it as an operating
From
safety, so
NorCal.
I'm following from what I'm hearing from people.
You might want to direct that towards
Yeah, I think I've better.
Towards who?
Dan Speak.
Yeah.
Yeah, okay.
In all the acronyms, you and I know what they are, the medical community, but like Jeff and Tom, I mean, the average person didn't have a clue.
An ALS is a registered nurse, I figured out.
No,
Is that what it is?
necessarily.
That's a-
I'm here, and I see it's a head shaking no.
Okay.
So you don't know any of them, Tom.
So I guess not. I thought I had one of them. But is the system working now, as is?
Let me answer that in two different ways. The system design is designed to work and work effectively. The new plan that we are considering helps, I'll call it, iron some of the wrinkles out of the confusion or misinterpretations that we have had that have come to light. So the system is designed to work. Now, on a day-to-day basis, that relies upon cooperation of the individuals that are participating in the system. And that's what we are working with Mountain and with SIMSA and with the hospital to determine how we can iron some of those wrinkles out. They've been developing over a period of time, and it's not going to be something that's going to happen immediately, but it's something that has our full attention. So I apologize if I didn't give you a yes or no answer, but that's
It's
the
pretty
description.
political of you. I would hope out of all this that the lesson that we learned here is that our ambulance providers, our emergency service providers work cohesively and in tandem for the health of our community. And it sounds to me like there's been a little bit of a breakage in that, and maybe out of this we can get to the point where they're working together. And I don't know if they aren't. I don't know if they are. But I sure would like to see a little bit more cooperation amongst the providers for our community, for the medical.
I had a question, and I took a liberty while you were out of the room, Mr. Spees, and that was to speak on your behalf, and I just wanted to make sure I was correct. And that is that in our discussions over the last week, we've come to a point where NorCal EMS can support the revised or proposed amended EMS transportation plan, or is that your recommendation to the board?
Has it changed?
No. Not since yesterday at 3:58.
That is correct, and we have talked about it very intimately among Rick, who you have a contract with, and with our medical director and myself, so yes, we would. And, well, whatever the board decides is what I would take to our board of directors.
Thank you, sir.
Thank you, Dan. Any more questions for Dan, or any more questions for anybody on anything? Okay, in the board's ballpark now. You guys, what's the pleasure? What do you guys want to do? The chair cannot make a motion or second a motion, so it's up to these four. I do get the vote, though. Good one to start your first meeting, huh, Mr.
Yes, it is.
We just out of the darkness.
So mechanically speaking, of course, the EMS transportation plan, which was adopted by this board on September 9, stands until such time as it gets amended by
Chairman,
this
move
proposed
this on
law.
so that we can maybe bring it to a conclusion. I'm willing to make a motion that we amend the decision that was made last September in the adoption of the plan by adopting the amendments that are before us that have been outlined by staff verbatim know that we have the input from our consultant and from NorCal EMS, as well as the input from the two ambulance providers.
That is a motion.
Yes.
And I'll second that.
There's a motion and a second. Any more discussion?
I'm satisfied that we have reached a level of transparency to, in terms of the public being in the same loop as everybody else is.
And there's been transparency, and I agree, as far as the public goes, probably not enough. As far as the medical community goes, there's been plenty.
Yeah, there's no question there's been plenty amongst those that have been included in, but the rest of us have not been.
Mr. Egan?
Procedurally, the Board of Supervisors should recommend to NorCal EMS to
Okay, if that's what the wording needs
That's
to be
it.
for the motion,
That's it.
I would clarify my motion to reflect it, that we recommend that NorCal EMS accept these amendments on our behalf.
Thank you.
Mr. Hammond, you
I second that.
contrary to second. Okay, any more discussion before we vote? Madam Clerk, would you take a roll call?
Supervisor Chapman?
Aye.
Supervisor Alba?
No,
Supervisor Humble?
No.
Supervisor Hammond?
Aye.
And Supervisor Coyle?
Aye. Okay, thank everybody for coming, and we'll move on. We'll take a short break.
Short break.